In this video, we will explore restrictive cardiomyopathy, RCM. RCM is a rare type of heart disease that leads to stiffening of the heart muscle, heart failure, and other complications. We will discuss its causes, symptoms, diagnosis, and treatment options. Restrictive cardiomyopathy, RCM, is a primary disease of the heart muscle characterized by abnormal stiffening of the ventricular walls, impeding their relaxation during diastole. The impaired diastolic function leads to reduced ventricular filling and increased pressure within the heart chambers. This condition is distinct from other forms of cardiomyopathy, such as dilated and hypertrophic cardiomyopathy, based on its unique pathophysiology. RCM accounts for approximately 5% of all cardiomyopathies and can occur at any age, with a slight male predominance. The underlying etiology plays a crucial role in the clinical presentation and management of RCM. In this section, we will explore the various causes of restrictive cardiomyopathy, RCM. It can be caused by genetic mutations affecting the function of myocardium, leading to impaired relaxation and increased stiffness. Acquired causes include infiltrative diseases like cardiac amyloidosis, sarcoidosis, and hemochromatosis. Restrictive cardiomyopathy, RCM, involves myocardial fibrosis and impaired ventricular relaxation. Fibrosis causes increased stiffness, reducing compliance. Impaired relaxation leads to abnormal calcium handling and prolonged isovolumetric relaxation time, reducing ventricular filling and cardiac output, resulting in heart failure symptoms. The clinical presentation of RCM is highly variable and can mimic other forms of heart disease. Fatigue, dyspnea, shortness of breath, and peripheral edema are common symptoms encountered in clinical practice. Patients may also experience orthopnea, difficulty breathing when lying flat, paroxysmal nocturnal dyspnea, sudden awakening with shortness of breath, and exertional intolerance. The symptoms typically progress as the disease advances, and prompt diagnosis is crucial for optimizing patient outcomes. Diagnosing restrictive cardiomyopathy requires a comprehensive evaluation that integrates clinical presentation, imaging studies, and biopsy. Echocardiography and cardiac MRI are used to assess ventricular function and myocardial fibrosis. Biopsy may be needed to determine the underlying cause. Echocardiography is important in diagnosing RCM, with features such as thick ventricular walls, enlarged atria, and abnormal diastolic measures. Cardiac MRI can further assess fibrosis and scar tissue, providing better differentiation and guiding treatment decisions. The management of RCM focuses on symptom relief, preventing disease progression, and addressing the underlying etiology when feasible. Pharmacotherapy plays a central role in the symptomatic management of heart failure symptoms, including diuretics to alleviate fluid overload, beta blockers to optimize heart rate control, and medications targeting comorbidities such as hypertension and diabetes. Invasive interventions, such as cardiac resynchronization therapy and ventricular assist devices, may be considered in select cases with refractory symptoms. The prognosis of RCM varies depending on the underlying etiology, extent of myocardial fibrosis, and early recognition of the disease. With advancements in management strategies, survival rates have improved, particularly for individuals with amyloidosis who are eligible for targeted therapies. However, RCM remains a progressive disease, and heart failure is a common complication. Thromboembolic events, such as stroke and systemic embolism, are also significant concerns due to intrinsic abnormalities in the atria. Infiltrative diseases, such as cardiac amyloidosis, sarcoidosis, and hemochromatosis, can lead to RCM through different mechanisms. Cardiac amyloidosis, the most common infiltrative disease causing RCM, is characterized by the deposition of insoluble protein fibrils in the myocardium. Sarcoidosis, a granulomatous inflammatory disease, can infiltrate the myocardium and disrupt normal electrical conduction. Hemochromatosis, an iron overload disorder, leads to iron deposition in the myocardium, causing structural and functional abnormalities. Genetic mutations underlie a significant proportion of RCM cases. Various genes implicated in sarcomere assembly, calcium handling, and extracellular matrix remodeling have been identified. These mutations follow an autosomal dominant pattern of inheritance in many cases, while others can be recessive or X-linked. Genetic testing allows for earlier diagnosis, risk stratification, and appropriate counseling for affected individuals and their families. Endomyocardial biopsy remains an essential tool in the diagnostic evaluation of RCM, particularly in cases with suspected infiltrative diseases. It provides histopathological confirmation of the underlying etiology, allowing for targeted therapy and prognostication. Biopsy findings may include the identification of abnormal proteins, inflammation, fibrosis, and genetic mutations. However, biopsy should be performed judiciously, considering the associated risks and the potential yield of diagnostic information. Advances in our understanding of the molecular mechanisms underlying RCM have paved the way for new therapeutic approaches. Gene therapy aims to address underlying genetic mutations by delivering normal copies of the affected genes or suppressing the expression of harmful proteins. Stem cell transplantation holds promise for regenerating damaged myocardium and improving cardiac function. These emerging therapies are still under investigation, but they offer hope for more targeted and efficacious treatments in the future. In conclusion, restrictive cardiomyopathy is a complex condition characterized by abnormal ventricular stiffness and impaired relaxation. Its causes can be genetic or acquired, often related to infiltrative diseases. Diagnosis involves various tests, and management focuses on relieving symptoms and addressing underlying causes. The prognosis varies, and complications like heart failure and clotting are concerning. Infiltrative diseases like amyloidosis, sarcoidosis, and hemochromatosis play a significant role. Genetic testing and biopsy are important tools for diagnosis. New therapies like gene therapy and stem cell transplantation show promise. Understanding RCM is crucial for better patient outcomes.